The Quebec provincial election is around the corner, and the Association of Psychiatrists of Quebec is taking the opportunity to call on all political parties to make mental health an election priority.
We're asking for us to be more intentional, and that's the thing that's missing right now. We are asking, obviously, for more resources, but actually for resources to be spent more appropriately and in a more focused way.
Here's what the group wants from the elected party. Appoint a minister responsible for mental health. Roll out alternatives to hospitalizations for everyone from youth to seniors. Strengthen suicide and homelessness prevention. Increase support for caregivers and expand teleconsultation and telemedicine for mental health.
Healthcare does not revolve around the hospital necessarily. It could expand, and that's what we need to do. We need to get out of some of these traditional methods that don't actually work, and something a bit more stable that actually survives the cycles of election, which we experience every 4 years, and everything changes. That doesn't help the system.
The association says the number of people hospitalized for suicide attempts tripled between 2010 and 2023, and says nearly 25 million hours were lost due to mental health issues among healthcare workers.
We need a focus on mental health that is global in its thinking so that it connects with all of the other pieces of the health puzzle, the justice puzzle, the prison puzzle, because all of these touch the mental health issue. It's a transversal issue.
Hughes says 57% of people who are homeless are dealing with mental illness. He says homelessness is continuously on the rise, and the next government needs to take more action to prevent it.
If they don't make that a huge priority, we will continue to see the kinds of increases that we're seeing that are overwhelming our parks, our hospitals, and our metros. And I don't think any Quebecer finds that acceptable.
We reached out to the 5 major provincial political parties to get their stance on this subject. The Parti Québécois says it's releasing its platform later and will not comment just yet. The CAQ says homelessness and mental health remain priorities, and it will release its commitments when their platform comes out. The Quebec Conservatives said mental health must be a priority for all parties, and it supports several of the recommendations. The Quebec Liberal Party says access to healthcare is a priority, and it's committed to making telehealth accessible to all Quebecers. And Quebec Solidaire says housing, mental health, and homelessness are 3 of its biggest issues.
It is being a hard crisis here, and specifically with the homelessness crisis we're living. I mean, a lot of people on the streets obviously are facing some severe mental issue.
The association hopes whichever party forms the government will come up with long-term plans instead of band-aid solutions.